The plantar fascia is a structure made of connective tissue on the sole of the foot. It supports the arch of the foot and plays an important role in the mechanics of walking. When the foot is in a position known as plantar flexion, which means that the toes are pointed down like a ballerina, the plantar fascia is under less tension. When the foot is pulled up in dorsiflexion, the plantar fascia tightens up under tension. Sometimes the plantar fascia becomes irritated and inflamed at the site where it attaches to the heel bone, the calcaneus. This is a condition known as plantar fasciitis. While sleeping, the foot usually rests in plantar flexion. Upon taking the first step after getting out of bed, the plantar fascia is rapidly stretched. This places extra tension at the attachment of the plantar fascia to the calcaneus. If the plantar fascia is inflamed, this can be very painful. And so plantar fasciitis often causes the most severe pain upon getting out of bed in the morning or standing after sitting for a long period of time. For people who suffer from plantar fasciitis, it is important to gently stretch the plantar fascia before standing and walking each morning.
So this is the stretching for the gastrocnemius and soleus muscles. So that will affect for your tendon Achilles contraction. So if it is inflamed, so you have to stretch it while you are doing this theraband exercise. I will assist more to stretch the gastrocnemius muscle. While he is stretching, I will explain this. This is the plantar fascia, and this is the tendon Achilles, and this is the gastrocnemius and soleus muscle. If the tendon contracture and the plantar fascia contracture, you will feel an eve pain. We call this condition plantar fasciitis, and this is Achilles tendinitis. So we have to treat both of them. Better to give a warm treatment here, and you can do the bottle rolling exercise and the towel exercise. I will explain these exercises later on. And today I am going to introduce the kinesia tape and the rigid tape for this plantar fasciitis and Achilles tendinitis, both of them. Start Okay, now he has to stretch the gastrocnemius and soleus muscles and lift the leg up. So then I will apply the tape like this to the gastrocnemius. So the tape is stretching. So this is kinesia tape. So you will have the good length to apply this tape on the specific muscle. You have to cut the edges so that will not roll and remove from the skin. And I will divide this part. So this will be half I tape and half Y tape. Actually this is Y tape. So this is the underneath of calcaneus. You have to rub it so that will activate the glue underneath this tape. Okay, then pulantaran kapulu sama. So I will apply 70% stretch up to the tendon and in a good position, I will apply 2 tapes, 2 eye tapes. So those are the 2 eye tapes. You have to curve it like this. And in every tape application, he has to stretch these gastrocnemius and soleus muscles. And this is to correct the tendo-Achilles. Stretch. So this is the normal tape, and I will stretch it like this and apply on the tendon. And the ends should be zero stretch. And this is for the correction of the plantar fascia, to keep the foot arch correctly. You have to curve the edges like this. You have to tie middle. And this is the normal length, and this is the stretched. So we can apply it on the arch, and the edges should be zero stretch. Okay, now relax. So this is a TheraBand. He was applying the stretch by a TheraBand. So this is the white tape application to cover the gastrocnemius, the heads. So this is the left head, and this side is the right head, and this is the correction tape to the Achilles tendon, and this is the correction tape for the plantar fascia. Okay, now I'm going to apply the rigid tape application for the plantar fascia. 1, 2, 3, 4, 5, according to the finger number. Right, 1, 2, 3, 4, 5. Okay, now we have to apply the tape 1 to 5, 1 to 1, 5 to 5, 3 to 3. Okay, we'll see how to apply this tape. One, two. We have to apply the stretch, and it should come behind the calcaneus and end up in the 5th digit. And apply the glue where? And then 1 to 1. It's like horse shoes chain. Don't think about the wrinkles, because this is not stretchy, so it will produce some wrinkles, not like the kinesio tape. So this is 1 to 1. And this is 5 to 5. And there's only remaining tape is 3 to 3. So you have to apply on the middle and behind the calcaneus, around the calcaneus, and stretch, and apply on 3 again. On 3 again. So this is like your actual anatomical plantar fascia. So you can see the arch is maintaining still because we have applied the kinesia tape as well, and we have to support it by applying a tape on the arch. I'm not covering whole the circumference because it will stop the circulation, only the halfway through the circumference. And this is how to finish the tape. You have to apply 2 tapes on the all edges. And another tape to maintain the arch. Okay, now that's the end of rigid taping. Now you can see around how the tape application is applied.